Good morning, I'm Dr. Peacock. This morning I want to show you a case I'm very excited about, and a patient that came all the way from Atlanta, Georgia to have her foot surgery done. Before seeing us, she had gone to a couple other foot surgeons, very qualified men, and they had proposed some fairly extensive surgeries for her that would have taken a long time for her to recover and a lot of cost for her. Let me show you her foot, the x-ray, so you can kind of get a little bit of indication.
Mainly no walking on it.
Yeah, she wasn't, the guys,
no weight bearing.
The guys who were going to do her surgery was going to be a non-weight bearing type surgery. But here's what we did with her. If you look at her foot, she's got dislocated, or her toes are drifting medially, and she got pre-dislocation syndrome with the second toe here. So what we did with her, we did an osteotomy fifth met, and we did Isham hammertoe corrections of 2 through 5, as well as an aching osteotomy on her hallux. Now, this was done with minimally invasive surgery, and she was never off of her foot. She was able to walk the same day. We did this in the office on a local anesthetic. It took us about 30 minutes to do this. We did the Isham hammertoes in the standard way Dr. Isham talks about this. We did do a little modification of the second toe, which I'm going to hopefully try to publish, but we'll talk about that in some other videos. Today I want to show you our patient. This is our patient from Atlanta, Georgia. This is Miss Judy. And let me show you her foot now.
Wonderful.
Yeah, good. I want you to stand up so people can see your foot. Here's her foot here. So you can see now when she stands, her foot are pretty straight. These toes are not drifting medial like they were. If you look at her picture before the surgery, you can see how much trouble she was having. Main thing with this drifting of the second toe is just a lot of pain in this second joint here. And now she just told me this morning she was able to kind of get back to clean her house and stuff. She was unable to do that kind of thing. So how do you feel about the surgery?
It's great, amazing. I actually found Dr. Peacock through YouTube.
Yeah.
Just researching hammertoe, and I found out about the procedure, Dr. Isham, and I was going to go all the way to Idaho. And the day I called, Dr. Isham, who is retired, was in the office, and I said, you know, I'd like to maybe find somebody else. He said the only other one is Dr. Peacock in North Carolina. So I'm totally pleased. I walked out of the office. Otherwise, I would have been in bed with no weight bearing for 2 weeks, in a hard cast for 2 months, and in a boot for 4 months. And so compared to walking out of here and 7 weeks later being able to just function is just great. I'm just so pleased. And I thank God.
Yeah. So anyway, that's the reason I want to show you this is that the minimally invasive surgery has a lot of power, and you can do a lot of correction and get people out of pain, and you can do that without it costing thousands and thousands of dollars in the hospital, and you can do it without them having to be non-weight bearing.